The protests at the border help frame a question that we can now begin to ask. The United States and Canada took different approaches to dealing with the pandemic. Who wore it better? And as the newly drawn districts survive another legal challenge, can we begin to see what the midterms will look like? Today is Sunday, February 20th, 2022, and this is Flashpoint. Hi, and welcome to Flashpoint. Good to be back with you after a Sunday off last week to make way for the Olympics. But here we are on the 20th of February, and we are suddenly hearing people daring to ask an enticing but fraught question. Have we reached the end of the pandemic? As many health experts predicted, the massive Omicron surge has subsided, and we see case numbers dropping dramatically. It is probably too soon to start dancing in the end zone, but we see the foot coming off the brake in a number of ways, including in Michigan, the advice on wearing masks in public places and in schools. And little by little, like storm victims heading outside to inspect the damage, we'll start assessing what we got right and what we got wrong in dealing with something for which there really wasn't much modern precedent. As we watch the protests that shut down the Ambassador Bridge, I found myself thinking about the two different laboratories that were operating side by side, the American and the Canadian versions of responding to the coronavirus. The stereotype here is that Canadians are more than willing to fall into compliance and be quite mannered about it. I've always joked that Canadians are pathologically kind, but in those protests, we saw a lot of Canadians had hit their breaking points. On this side of the border, the breaking point came much, much sooner. Vaccination rates were fairly equal until Canada was able to get more of the vaccine, and then they quickly outpaced our vaccine rates. They suffered far fewer cases and far fewer deaths, despite the fact that there are a lot of similarities between Americans and Canadians, especially when it comes to things like obesity and hypertension. So what conclusions can we draw at this point? We're going to talk about that this morning. And if we are starting to put the pandemic in the rearview mirror, rest assured it will remain right there front and center as we head into the midterm elections. We'll talk about that too. It's all today on Flashpoint. Well, the tie-ups at the U.S.-Canadian border created quite a few problems on both sides of the river, but also showed us an interesting collision over policies regarding the coronavirus. Canada has had far fewer cases and far fewer deaths per capita, but with tighter restrictions and controls that, as we saw, had some Canadians reaching the boiling point. Well, what are we learning about policy and pandemic? Let's talk about it with Dr. Donald Venn. He's an infectious disease specialist at McGill University, regarded as one of the top epidemiologists in North America, and he joins us today from Montreal. And Dr. Jim Baker, the Ruth Dowdone professor at Michigan Medicine and the man behind the Pandemic Pondering blog, who we've turned to quite a few times now on the program. Dr. Venn, I want to start with you, and let's start with whether it feels possible to you to really compare the U.S. and Canadian responses. Are we alike enough, or are there too many population and system differences to be helpful?
Well, I have to tell you, I think that the differences are pretty enormous. Yes, we are North American neighbors. I've certainly lived in the U.S. and I have a lot of friends in the U.S. But I think that there's several different major levels. First and foremost is our healthcare system. It's a socialized healthcare system which provides equal access to medical care regardless of your socioeconomic status. And of course, we also have a different framework for how healthcare is governed and rolled out. And we also have differences, obviously, in adherence to public policies.
We do have, I was surprised to read, though, when it comes to demographics, we are more alike than not when it comes to things like obesity and hypertension rates, a lot of the sort of comorbidities. Correct, Dr. Venn?
Yeah, absolutely. So our age pyramids are very similar in terms of we have a predominant, we have a very heavy, elderly and frail elderly populations, both institutionalized and community dwelling. We have a lot of similar comorbidity rates, the same comorbidities themselves in terms of cancer and obesity and heart disease. So that in itself certainly doesn't explain the differences we've seen between countries.
Yeah. Dr. Baker, when you just look at it on the face of it, Canada, far fewer deaths, far fewer cases per capita. Is it just that simple? Does that mean that Canada did a better job of managing this than we did, or is it much more complicated than that?
I think if you look at deaths and illness, they did a much better job than we did. You also look at vaccination rates. They were over 80%, and we were 63 or so. So I think they did a much better job there. But if there's one thing that I think they did really well at is the consistency of their response. We seem to go back and forth. We've let up on restrictions before we got the population vaccinated. And that did two things. Number one, it allowed a lot of people to get sick and die. But the other thing is it undermined confidence in what the government was doing. So that people would see these outbreaks and think, well, what we're doing isn't working. The vaccines must not work. And that unfortunately created a lot of problems when we then tried to backtrack and get people covered.
Interesting point, because Prime Minister Trudeau got to lead Canada through the whole thing. We had an election in the middle of ours. That complicated things quite a bit, didn't it?
It certainly complicated things. I think there were problems on both parties in terms of the approach to this. But even before the election, people were releasing restrictions before the population was protected. And the key for these restrictions was they were really a temporizing measure until there was a definitive way to protect people, like a vaccine or an antiviral drug. And unfortunately, we weren't able to wait long enough to get enough people vaccinated that the population was really protected.
Dr. Venn, as I mentioned at the top of the program, there is something very much, it seems, in the Canadian character about being compliant and following the rules. And yet we also saw that we were arriving, I guess, at sort of the breaking point for a lot of folks in Canada over these restrictions. Maybe things have timed out pretty well here, that we're starting to see Omicron subside. Could Canada have gone on with its same level of compliance if it had gone past this, or needed to go much past this point?
Well, first of all, I think you raised a very important point, right? Which is that 80% or so of the population wanted vaccines. So when there were vaccines that were made available, in fact, at the beginning, we even had a rationing of supplies. There was, sort of a very strategic approach to rolling out the vaccines, targeting and providing it to the most vulnerable, which was at the time the elderly, and then slowly rolling them out to different patient populations based on certain risk factors, notably age. And at that point, people were getting the vaccines. They bought into the 2-dose concept. Eventually, people also bought into the 3 or 4 dose concept that they were immunocompromised. But the issue, of course, is that this pandemic has stretched out too long. It has come with science that has come at breakneck speed, which may go over the head of a lot of the general public. And as a result of that science, there have been changes in policies, even changes in the number of doses required and the timing of the doses. And the problem is that that pandemic fatigue was a perfect nest for the convoys and the other protests that people were starting to sort of manifest. A minority voice, nonetheless, but they were manifesting, and that's what you've seen recently.
Dr. Baker, does it boil down then to, if we could get rid of, we had all these arguments, of course, over masks and over social distancing, what places should be open, closed, things like that. If we had just been as willing to adopt and adapt to the vaccine as Canada was, what difference would that have made, you think?
Well, I think it would have helped tremendously, but we made mistakes even before then. We weren't consistent in what we were telling people. People can do one thing very easily. So I think if we just told them to avoid crowds and to wear a mask, they might have done that. But we're giving them information about, washing down surfaces with bleach, about bleaching even their groceries when they came home. And people really got confused. Even the government initially suggested we didn't need to mask. So in fact, there was an undercurrent of disbelief by the time we got the vaccines. The vaccines were inappropriately marketed as a way to sterilize the population. People then believed that if they would never get infected if they got the vaccine, and that was never the point of the vaccine. So in fact, when they started seeing these so-called breakthrough infections, which were infrequent and usually very mild, they lost faith in the vaccine. So I think initially there was a great impetus to get vaccinated, but we actually undermined our own desire to get vaccinated with the message that was being given.
Well, that's a pretty good encapsulation, perhaps, of a mistake made on our side of the border. Dr. Venn, if Canada had it all to do over again, do you think were there mistakes made in the Canadian approach that you would change from here? If it happens again, and we kind of have to doubt that this might be our last go-around with a pandemic, right?
Well, all the issues that Dr. Baker just raised actually were also points that arrived here. There was this overselling of the impact of the vaccines. There was this mixed messaging by government, public health policy or agencies. So all of that happened here. The issue, however, is that it didn't happen in such a polarized fashion, at least not in the first 2 years or so.
Yeah.
And it also wasn't one or the other. So it wasn't that we did vaccines or masking. We had indoor masking. In fact, even eventually upgrading to better types of masks for indoor spaces, at a much longer period of time than the United States, as we were doing the other things like the rolling out of the vaccines and all the other measures. So I think what happened for us is that we were perhaps slow to come out of the starting gates, but we had a lot of layered approaches. We weren't perfect, trust me, and our governments are, both at the provincial and federal level, are actually sort of, perhaps to some of us abandoning ship a little bit too early. And there's some concerns on that end. But I think up until now, we've been able to use multiple layers through vaccinations and other public health restriction of social activities to be able to keep things somewhat under control.
Dr. Baker, I've only got a couple seconds left. If something like this were to happen again in the U.S., have we been able to learn any lessons moving forward, or are we still so polarized and politicized that we can't fashion a better approach?
That's a very good question. I think we are incredibly polarized, but one thing we need to understand is these are inherently political decisions, and they can't exist in a vacuum in a public health perspective. So in fact, we need to get the government together and speaking with one voice early on to have an effective response. And that's something that didn't happen here.
Sure didn't. Dr. Baker in Ann Arbor, Dr. Venn in Montreal, great conversation and a lot for us to think about. Thanks so much for the time today.
Thank you.
Thank you.
You bet. We'll come back. We'll talk about the impact of the pandemic on the upcoming midterm elections. This is Flashpoint on Local 4.
Get the best deal on iComfort at Gardner White's President's Day sale. No one beats our guaranteed lowest price on all Serta iComfort mattresses. Exclusively at Gardner White, save an additional $200. Plus, take an extra 10% off. Plus, we pay your tax. Plus, get a $100 grocery gift card. Plus, we make it easy with 0% financing up to 60 months. And free TVs, free MasterCards. All in stock with free same-day delivery. That's why there's Gardner White and no one else. Detroit's #1 mattress store.
A progressive jackpot that grows with every play. That's what makes Fast Cash from the Michigan Lottery such a thrilling game. The progressive jackpot keeps building and building and building until jackpot. Fast Cash. The fun keeps building.
Now's the time to upgrade your motorcade during the President's Day sales event. Monumental lease deals for returning FCA employee lessees, like $189 per month lease on the redesigned 2022 Jeep Compass Limited, or lease a new Ram 1500 Bighorn Crew Cab for just $199 per month. That's right, returning FCA U.S. employees can lease a new Compass for just $189 per month, or a Ram 1500 Bighorn for just $199 per month. Hurry in to a Metro Detroit Chrysler Dodge Jeep Ram dealer.
You put a lot of trust in smart devices to make things easier, automatic, and safe.
Safe.
Tuesday morning at 6:30, the Local 4 defenders expose the dangers of being too connected and reveal simple steps to keep hackers from using me to get to you. Tuesday on Local 4 News Today.
It was interesting. We got to the break and both Dr. Baker and Dr. Venn said, you know, what nobody really wants to talk about here, this policy often boils down to how many deaths are acceptable? What kind of death rate are you willing to live with? Well, let's bring in this morning's roundtable now. Zoe Clark is here, program director for Michigan Radio. Nolan Fenley, above her there, the editorial page editor at the Detroit News. To the right there, Stephen Henderson is the host of Detroit Today on WDET, and Steve Mitchell, the pollster and analyst from Mitchell Research. Steve, I want to stay with the pandemic here for just a second and its impact on these upcoming midterm elections. How central do you expect pandemic response, decisions, and policies to be to the elections, or does it begin to fade in the rearview mirror by then?
I think aspects of it will always be part of the discussion in 2022. I'm not convinced it's going to be as an important issue as everyone thinks. There was a comment yesterday or 2 days ago from the head of Moderna who believes that the next variant is going to be even weaker than the Omicron variant. And in fact, we may be at the end of the entire pandemic. If that's the case, then there'll be other issues that come into play.
Nolan, I think there are a lot of Republicans lying in wait to go after, say, for instance, Governor Whitmer on the way that she responded to the pandemic. Do you expect it to be front and center?
I don't think so. I think hopefully by the time we get to November, this has all started to wane in a big way. But if you track her numbers since the fall, when she stopped really actively trying to manage the pandemic, her numbers started rising. And I think there's a lot of Democrats around the country who took a look at that. And, that's why you've seen mask mandates and other things starting to lift over the past week or so without any real change in the pandemic or the science. So I think, had the election be held last November, would have been a different story. I think this November, it may not be as big an issue.
Well, then maybe that, Zoe, the old saying, it's the economy, stupid. Is that where we go back to, as we often do on elections, and at a time when inflation is running the way it is that what ends up deciding what happens in November?
I think at this point, it's hard to believe that it isn't, right? And you have even Democrats, moderate Democrats, coming out just this week. In fact, Congressman Kildee and Alyssa Slotkin here, Congresswoman Slotkin from Michigan, co-sponsoring a gas tax. And so we are definitely seeing that actually Republicans and Democrats agreeing, I think, going into the election. They want to put COVID behind them, although Republicans are going to continue to bring up Whitmer's handling of COVID because this seems to be an issue that is winning at least some independent voters for them. Yeah,
the ones that decide most of our elections in Michigan. Stephen, what do you expect everything to turn on this year, or is it too complicated to boil it down to one or two things?
I think it is more about money than it is about COVID at this point, and inflation is giving the Democrats fits. They have not found a way to talk, I think, about the broader trends in the economy. I mean, the strange dynamic where you've got all kinds of things booming, including wage growth that we haven't seen in a long time, and of course the stock market is going crazy. But inflation is what people are seeing when they go to the store, and there isn't a good way to combat that. Democrats are going to have to come up with a narrative that talks about these things in the economy that are actually working, and some of them working way better than they have in a really long time, and de-emphasize the inflation.
Well, Steve, if I put you in charge of both sides, if you're the Democrats, you want this election to be about what? And if you're the Republicans, you want it to be about what?
Both want it to be about the president of the United States. The Democrats want it to be about the former president, Donald Trump, and the Republicans want it to be about the current president, Joe Biden. It's hard to believe that Joe Biden right now has a lower job approval than Donald Trump did at a comparable period. So that's what this election is going to be about. Both parties are going to frame it about Biden and or Donald Trump.
And we know, too, to that point, that the party in power in the White House in midterms tends not to do very well. So, I mean, this is going to be really fascinating to watch about, Biden being at the top of the ticket but his name not actually being there.
And as Steve has pointed out on the program before, that's often bad news for a governor, because they don't often come up in the middle of a midterm with their own party in power as well. Nolan, we've watched a number of challenges to the redistricting maps fail. There's still one or two, I think, still hanging out there. But is this it? Do we basically have a handle on who's running where as we get now not that far away from the election? These decisions kind of need to be poured.
Yeah, I would hope so. I mean, we got till April 9th for these candidates to file. So I would doubt that it's going to be thrown into even more chaos. I mean, it's the interesting part of this whole redistricting process to me at this point is it doesn't seem like Democrats got what they paid for in passing this ballot measure in 2018. Congress could very well end up, if it's a big Republican year, could end up our delegation with a Republican majority. And I don't think that was the intent of Democrats when they pushed this through. I don't know about the State House and State Senate. Steve Mitchell probably know more about that than I do. But the maps don't look that bad for Republicans.
House maps look very good for Republicans, and the Senate map is more difficult. But given the year, I suspect Republicans will retain control of both houses.
Yeah, in fact, Steve Henderson, one of the things that we're already seeing that's going to happen is you're going to have you got two sitting Democrats having to run against each other in Levin and Stevens. What are the more interesting races looking like to you now that we start to understand what this landscape looks like?
I mean, I think we're starting to see some people who have not raised their hands before say that they're interested now that they look at the lines. I think that one of the lessons of this map is if you take political interest out of the equation to the extent that we did, what you end up with is something that makes a lot of different people really unhappy, and maybe that's the test we ought to be using. The people who are not happy with this map include both Republicans and Democrats, and we're just gonna have to figure out what the communities that they've created are going to look like once people start to vote. I predict that in 2 or 3 cycles, people will think a lot more of these maps than they have of the maps that were drawn by partisans in the past. But it may take a while, and there's going to be some bumps and bruises. You're going to lose some incumbents, no question, because of the way this was done.
But you're right, some interesting people getting in, and I want to make clear Portia Roberson has assured me that she is not running for Congress simply to get out of being on Flashpoint more. She told me that's absolutely not the case. Zoe, what do you what looks like the most interesting thing to you as you look out at these new lines?
Well, I mean, just the fact that you have congressional districts where there weren't necessarily huge names to jump in right away, open seats.
Yes.
I mean, in the 10th, you finally had John James jump in, versus then you have these districts with 2 incumbents going after each other. But again, I'm fascinated by the Alyssa Slotkin seat. And for me, over the past, every election cycle since she won, that district has been so incredible, sometimes going for Trump and for her. Thus why folks like moderate Democrats are looking to Nancy Pelosi in the House, bringing up this gas tax, moratorium. And so watching what these moderate Democrats have to do come this midterm is just going to be fascinating.
We've got is that the Fenway Hound that is joining in right now? I love it. It seems to be. Steve, your reflections on what you just heard.
Which Steve?
I'm sorry, Steve Mitchell. You jump in there on these new lines and new races.
I think it's got a couple of fascinating races. You've got one over in West Michigan between Fred Upton and Bill Huizenga. Fred's the dean of the Michigan delegation. Yeah. The only thing that might save Fred Upton from being defeated in the primary is the fact that there's a third candidate besides he and Congressman Bill Huizenga named Steve Carra. Carra's been endorsed by President Trump, and that actually might save Upton from losing. If it's a 2-way match, there's no way that Bill Huizenga does not win that race. Then you've got the Andy Levin versus Haley Stevens race, 2 incumbents in Macomb County, another fascinating race. I put my money on Levin there. That's a long-time name in Michigan politics.
Sure
so, and Debbie Dingell's got to move, and Kildee's running again in an interesting race. It's fascinating all over the state.
It is, and I'm going to look forward to watching it all with the four of you and Nolan's dog. Thanks, gang.
And the dog's perspective.
I know, I love it. Thanks, gang.